maken. Hello, everyone. Good afternoon. Actually, one second. Let me clean this screen. Okay, hopefully that's a little clearer now. All right. Hi. Thank you for joining us on this Fraxel webinar, our family favorite. All right. So first, I am going to have you put in the Q&A what you were hoping to achieve from Fraxel laser resurfacing, and I will address these at the end. So my question to you is, do you want help with your hyperpigmentation? Do you want help with melasma? Do you want help with skin texture? How about reducing wrinkles and even some brown spots? Do you want to decrease precancers and improve the overall health of your skin? Do you see his little red blotches on the left cheek? Those are precancers. And see the brown pigmentation on his forehead and just the sun damage and dullness of his forehead versus afterwards, after one treatment. Would you like your skin to be clearer and to glow? Would you like your hands to look younger, both with reduced brown spots and also with tighter skin? Or maybe you're just looking to improve some acne scarring or scarring from a surgical procedure or a traumatic accident that you've had. All of these results I've just shown you are clear dermatology results. So, results that we have had in our office with just one, maybe two treatments of Fraxel laser. And I will tell you that the results of Fraxel laser get better the more you do them. So, my patients who have now done an annual Fraxel for 3, 4, 5 years, their skin is literally not aging. They're looking younger and younger every time I see them. And in my opinion, this is the definition of success. So, what is Fraxel laser? Fraxel laser is a minimally invasive skin resurfacing treatment. So, it's not CO2, which is trending on social media. There's no blood, there's no scaring small children. It is a laser that will give you some downtime, and we'll talk about that, but it is minimally invasive, but it will resurface your skin. It works by using microscopic laser columns. And when it treats with these columns, it treats in a pixelated fashion so that the surrounding skin is untreated. And so we can treat the pixelated columns very, um, very aggressively, but safely. And that results in these amazing clinical outcomes that we see after a single treatment. So this laser produces tons and tons of collagen, and that's what makes our skin look so healthy, have that glow. It can be hard to quantify, even from pictures sometimes, the glow that people get after having a Fraxel treatment. I will tell you, I just had my treatment about 10 days ago, and I could not be happier. I've done the Fraxel many times. I try to do it once, at least once a year, but my goal is twice a year. And every time I do it, I feel like my skin is better and better. And it was the same with this treatment. I am just so happy and so thankful we have this technology to improve our skin. Okay. So why should you trust this device when there are so many lasers out there and there are so many energy-based devices? So now we have beyond lasers, radio frequency, and we have ultrasound, and we have microwaves. Why should we trust an old-fashioned laser? Well, the fact is, this technology has been around since before 2003. So, this device was FDA approved in 2003. So, what does that mean? We have so much experience with this laser, over 20 years of experience, and the laser has undergone multiple rounds of changes, meaning multiple times that it's been updated, improved. We've maximized the settings. We know exactly what we can do and what we can't do. And in my opinion, it's one of the lasers with the best safety features out there. It's a one of a kind, a non-ablative technology. There have been over 1 million treatments performed, and that continues to go up almost exponentially. It's clinically proven for results and efficacy. And there's over 50 published clinical trials and studies that are published on this, not to mention dozens of case reports. This is a technology that's tried and true, and we use that to our advantage in the clinic. So, this literally could be someone's head. I've treated a head like this before, but this is a potato. And after Fraxel, you get this beautiful peeled potato look. So this is a funny meme. Um, but literally, this can be representative of results. So, why choose Fraxel? Well, I will tell you, no one has perfect skin. And we all have things we want to change. People have come into the office and I think their skin is absolutely perfect and they're pointing out little things on their face that they want to change. So I don't care how good you look, I bet you have something that catches your eye when you look in the mirror. So with just one Fraxel treatment, you will see such a difference in your skin. And there's not many things, honestly, that you can do one treatment and see such a great change. So this is a great use of your time and resources as well. So there's minimal downtime. There's about a week of downtime. This is an easy procedure. There is numbing, there's cooling to alleviate discomfort. So you're very comfortable, or yeah, you're very comfortable during the treatment. It's great for all skin types. So even very dark skin types can do this treatment safely. We talked about the safety profile. And as you saw from our before and after pictures, it treats many different types of skin concerns and can be used to treat multiple areas of the body. So I showed a picture of the back of the hands, which is a very common area for us to treat. But I recently treated someone's forearms. I recently treated someone's arms above the elbow. We can treat the legs, we can treat the neck, we can treat the décolleté. Um, and if you go back on YouTube, you can actually see Dr. Yonan treating the back of my neck and the back of my shoulders because I wanted him to treat that for prevention of skin cancers and precancers. As mentioned, we see results very quickly. Even after one treatment, you can see an improvement of your skin. And as I mentioned, those results tend to get better and better with the more treatments that you do. So, how do we get these results? We numb for about an hour and a half, and then the treatment itself takes 15 to 30 minutes. And cool air helps with discomfort, as mentioned. And you can feel a little hot afterwards, kind of like having a sunburn. For most patients, that only lasts an hour or two, but it can last in a few patients up to 24 hours later. So this is very, very easy. After 24 hours, you're not going to feel any pain. You will have some downtime. I'm going to show you that. So this is my lovely esthetician, Nadia, I'm treating in this photo. And if you come into our office, you'll see that almost everyone who's been here some amount of time has had this treatment because we're all believers. What do you have to consider when you are planning this treatment? So, the main thing is sun avoidance. So, avoid being in direct sunlight for about 1 to 2 weeks before your treatment and 1 to 2 weeks after treatment. We don't like you using harsh products for about a week before, avoid self tanners for about a week before. And I wouldn't do anything that's irritating to your skin, like another laser treatment or chemical peel right before the treatment. 7 days of downtime, watch the sun afterwards. You're going to apply sunscreen, which we give you. Your skin looks red like a sunburn, and then that transitions to bronze and has a sandpaper texture, and then that kind of just flakes off for a few days. We give you a detailed instruction sheet and we give you the products to take care of your skin afterwards. So here is my other esthetician who had this treatment done. And you can see her 7 days of downtime. So, right away after treatment, and for the first day, she is red, she is puffy. Day two, she's already transitioning from red to a bronze discoloration. And then day three, she's very bronze. Day four, she's starting to peel. So, a lot of the redness has gone away or faded significantly. Her swelling is down significantly. And then day 4 and 5, she's peeling. Day six, she actually looks pretty darn good. It looks like most of the peeling is gone. She's a little tiny bit pink still, but if she put makeup on, it would cover easily. And this is very predictable. So this is representative of like 95% of people. Some people are a little faster, some people are a little slower. I tend to be a little bit on the slower side, but again, we have tips and tricks in our post treatment handout to help you heal completely and safely and quickly. Here are some other before and afters. So you can see reduction of her brown spots. You can see a beautiful glow of her skin and her lower face wrinkles out are smoother and less defined. I did Botox her forehead, so disregard the improvement there. It's a great representation of what multimodality treatment can do. Here's a close-up of another patient. This patient is a few decades older than the previous patient. She has very fine lines. She's got some loose skin. She's got some brown spots. You can see after one treatment, she has improvement in those fine lines. She's got improvement in the texture. If you look at the depth of her lines around her mouth, they're just so much softer and everything looks smoother and the brown spots are improved. So you're never too old to do this treatment. And like I mentioned earlier, I have many young patients in their 20s who are in the office doing this treatment because they, have access to it and they see what a great difference this makes over time. So you're not really too young. You're never too old to do this treatment. And again, I believe this same patient. So her fine lines are improved, textures improved, brown spots improved, overall health and glow of her skin is improved. Again, this is a patient with melasma and sunspots. You can see the melasma, that little mustache area, and the pigmentation on the cheeks is better. And then her sunspots are much less numerous afterwards. There is no live demonstration today. I have to go to parent-teacher conferences at a designated time. They wouldn't let me move it. So here I am. This is real world, everyone. Trying to balance work and motherhood. So here is a link to a live demo of me treating our wonderful practice manager. Like I said, I've said it before, twice in this presentation. Everyone has this treatment in our office. It's just an awesome treatment. But if you go to 44 minutes and 50 seconds, you can see the laser being done on Jenna. Okay, so another little meme, but honestly, you don't need filters if you do this treatment. Okay, thank you again for attending. Here is our raffle for you. You get these full-size skincare products. So Skin Medica is one of our favorite brands. It's got great data behind it. This is a wonderful, wonderful collection of products. I'm actually using that cleanser right now as we speak. My son borrowed it from me and he was using it and he said, "Oh, this is really nice." And he's 15. So to hear that coming out of his mouth was something. So it was kudos to Skin Medica. So great products here. The HA5 is a great hyaluronic acid serum. And then we've got the kit in there as well to brighten and hydrate. Okay, you've been waiting for it. We decided to give this to you guys again this year. So it's buy one, get one. So you'll purchase a treatment for your face, and then you can get your chest treated at no additional cost. These treatments have to be done on the same day and must be used within a year of this webinar. But that's very doable. And it's like I said, it's a great, great treatment. If you need your face treated, I can almost guarantee you need your chest treated as well. And you have the rest of the day to purchase, and then you have until tomorrow at 4 p.m. to purchase. So give us a call or text our cosmetic line. Um, Tracy is standing by, ready to book you as well. And I do know that my schedule is pretty booked up until at least the end of the year. But we do have two other doctors who have Saturdays available this year, including in November and December. And we also have a doctor who works until 6 p.m. every Friday. So you can come in on a Friday. In my opinion, by Monday, if you put makeup on, you will be ready for work. You might have some people ask you, um, what did you have done? Did you have a laser done? But this is not a big deal. You're not going to be scaring children. You're not going to scare your coworkers. And if you have it done on Friday, I think most people, like 80% of people, would be ready to work on Monday. Um, okay, and then just something kind of unrelated, but we are having a beauty happy hour, a beauty Botox happy hour. So, we're doing it this Friday from 4 to 6 p.m. This is with Dr. Greenenbaum, and she would love to Botox you, and you can receive 10 complimentary units just from coming in this Friday and getting your treatment done from 4 to 6 p.m. So this is awesome, guys. What doctor do you know who works these hours on a Friday? I think this is so great she's doing this. And I think it's just going to be really fun. I think there's like some snacks and beverages there too. So it's going to be super fun. Have a great time. Botox this Friday, 4 to 6. Let me see. Can I see the Q&A really quick? So you guys, thank you. There's no demo today. You can hop off if you want. Let me address some of the Q&A. And thank you again all so much for your attendance. Okay, so I am going to the Q&A, remove freckles and sunspots. Thank you so much for posting that. And so freckles, if they're true freckles and you've had them your entire life, they're actually yours to keep. So if they're dark from sun exposure, the Fraxel can lighten them, but the true freckles will be yours. And I love freckles. I think they're so cute. And I think they're like, are they still trending on social? They're trending on social media, Alyssa. So don't be afraid of those freckles. But the sunspots, absolutely. We will remove those. And actually, one thing I didn't mention is when I Fraxel you, I'm also looking for there's sunspots, which are easy to remove with the Fraxel. And then there's something that is a little bit different microscopically. They're actually more genetic spots called seborrheic keratoses. And these spots are a little bit thicker microscopically. And if I use a little bit of liquid nitrogen at the same visit as the Fraxel, it actually works beautifully to get rid of those really stubborn spots that may not have responded to laser previously. So don't be afraid of your freckles, but everything else, I think we've got it covered. Reduction of fine lines and discoloration. Yes, Fraxel can do that for you. The fine lines, this is not like having a facelift. You will still have fine lines, but what we notice is for most patients, they, especially if they are fine, they're not deep wrinkles, they do tend to be noticeably improved even after one treatment. Hyperpigmentation and sunspots to the face and upper chest. Yes, here is you would be a perfect candidate for this promo because again, if you have changes on your face, you most likely have changes on your chest. And so most people are going to benefit with treatment to both areas. And remember, this is a laser that reduces chance of precancers. It improves the health of your skin, reduces chance of non-melanoma skin cancers. So the chest or the décolleté area is an area we see a lot of skin cancer, especially in Arizona. When I had my treatment done 10 days ago, I had Maya treat my face, neck, and chest because I think it's so important to try to prevent precancers and skin cancers in those areas. Yes to all of these. Smoother skin. I really appreciate everyone who commented. This is awesome. Smoother skin. Yes, that is one of the things that's hard to show on a picture, but your skin will look so um it will look so smooth and it will feel smooth. Like when I'm putting on my makeup in the morning, I just love how smooth the skin feels after I've had a recent Fraxel. Yes, yes. Reducing basal cell carcinoma. Yes, that's what this Fraxel can do, especially if you do the Fraxel consistently, meaning you do it more than once. Once a year, I think, is enough to have this difference in the number of skin cancers that you're forming, but the exact frequency is still being discerned from research. I went smoother skin, remove brown spots, remove precancers. Yes. So if you remember that gentleman from when I showed earlier, um, and in fact, let me see if I can go. Yes, I can go back to him. So if we go back to this gentleman, look how much smoother his skin is afterwards. And like I said, his red spots, the blotchy red spots, are all precancers. And then, of course, we got some improvement in the health and the cosmetic appearance of his skin too. Would you recommend microneedling or other facials prior to doing the Fraxel? Well, the more you do for your skin, the better your results are going to be. But I will say you can absolutely start out with just doing Fraxel. And then what we tend to do, we see you a few times in follow up after that. After you've recovered and healed from the Fraxel, I see you in the office 1 month afterwards. We can make a game plan with what's next or maintenance treatments. So, I was just talking to someone yesterday in my clinic about she does a Fraxel annually. So she is going to do an IPL 6 months after the Fraxel. So for her, she does a Fraxel every October, every April before it gets hot here, before she leaves for the summer. She is going to do an IPL, and that's her maintenance. Some people, I do recommend microneedling instead, but a lot of times I will customize a maintenance regimen for you when you come in for your after Fraxel visit. Fraxel does help with large pores. This is one of the main things that can be done to help with pores. Pores naturally get bigger over time. And I just kind of envision it like everything gets looser, right? Our skin gets looser. The collagen is just not as young and as fresh, so it can't hold the pores closed anymore. And so the pores just start opening. So if you do something like this to rejuvenate your collagen, it will actually go back to holding the pores tight again, and the pores to our eyes will look small. So doing the Fraxel, especially if you do it regularly, like annually or twice a year, will keep the pores small. Um, is it possible to do face, neck, and chest at the same time? Yes, it is. And I highly recommend it if you are up for it because it's nice to get all the downtime done together. And when you're putting the products on, which are super moisturizing afterwards, it's just really easy to do face, neck, and chest all at the same time. And like I said, when I had my treatment 10 days ago, that's what I had Maya, our nurse, do for me. And it's just easier to do. Does the chest include the neck? No, the neck is actually separate, and you can add that on during treatment, or you can just exclude it. But then the chest does not include the neck area. Is it a one and done procedure? Well, nothing is one and done, technically. The closest you can get to one and done is a surgery because there's actual cutting and removing of skin in that in the procedure. But with anything we do in anti-aging, because we continue to age at the same time, um, there's no such thing as a one and done. There's always going to be a maintenance that I recommend in my clinic. However, this is something you can see a result after one treatment. So, it's not like I recommend you come in and have a series of 3 to 6 unless there's significant acne scarring. This is going to be, if it's just normal, like anti-aging treatment, it's going to be one treatment and then a maintenance in a year for most people. The cosmetic phone number I think was missing on the presentation. So I would love to give that to you guys. I'm going to have Kate read off the number for me.
480-651-4989.
So that's the direct number to the cosmetics. You can also reference our website for that. Can this be done on the actual, I'm assuming on the actual pink part of the lips? I don't typically do this on the lips themselves. If somebody wants treatment for their lips, I tend to do a TCA chemical peel. And I would love to talk to you more about that, Rosemary, in a consultation. Oh my gosh, you guys are so good. What happens if you have acne or pimples when you come in for your appointment? Well, I actually give you some antibiotics, which will help prevent infection and help prevent breakouts because way back in 2003, when I was actually using the Fraxel at that time, we were having patients apply Aquaphor to their face and afterwards, and patients were getting a lot of acne. And so we found out that this short course of antibiotics helps prevent acne as well as preventing infection. Excuse me. And now we have things that don't clog the pores to apply afterwards. And we also have some topical treatments, mainly vinegar soaks that I recommend afterwards. But for someone who's acne prone, the short course of antibiotics tends to help dramatically. Oh, Mia says that her hyperpigmentation has already gotten so much better with Fraxel. Thank you for that. Um, let's see. What's the difference between Fraxel and Cool Peel? Well, Cool Peel is a different type of laser, so it's a different brand. And in my experience, the Fraxel will give better results. But I've never actually owned a Cool Peel, so um, in this industry, you kind of have to pick and choose what tools you're going to have because the tools are so expensive. So when I was doing research for the Fraxel, based on research, recommendations from my peers, my own personal experience, I really thought Fraxel was superior to all the other similar lasers out there. If you have existing surgical scars, are those avoided with the Fraxel? Actually, Fraxel is one of the gold standards for treating scarring. And so if you have surgical scars, I highly recommend we treat them with the Fraxel. And sometimes I'll even treat, like, I have a patient I treated recently. I treated her face for anti-aging, and then she happened to have a scar on her arm and from a surgery. And so I treated that as well because when we treat scars with Fraxel, we see improvement of the pigment, improvement of the texture due to the collagen, and just a smoothing in general of the scar. Usually it takes more than one treatment, however. I had Fraxel in 2022 and it was extremely itchy. Was the treatment too deep? I don't think so. So we have in our treatment handout, our post-treatment care handout, we have some information on itching after treatment. Um, so itchiness can signal that your skin is too dry after treatment. It can signal an infection. And then sometimes it just means you need to treat it with a vinegar soak. And again, that's something that is outlined in our treatment. We can talk to you in person about as well. Mm. Can this be done around the eyes? Yes, it can. Oh, thank you. Um, this is this can be done around the eyes. Now, if we want to get right in the creases here and right up to the lash lines, we have to put metal eye shields into, or I'm sorry, over your eyeballs, underneath your eyelids, and we can safely treat the eyelids. For most people, they don't want to go through that. And so I pull down their eyelid skin and I pull up their eyelid skin. And whenever I can pull up or pull down and treat over your bone in that area, I can safely treat. And I do get really great skin tightening around the eyes. What is best for deeper lines around the mouth and chin for a 75-year-old? Well, I think if you haven't had much treatment done, I think that filler around the mouth and chin is going to be the most dramatic improvement. And we have fillers that look completely natural. And I think it's going to be the quickest results. And I think it's going to be the most economical. So I a lot of times recommend filler, even for someone in your age range, even if you've never had any other cosmetic treatment before. And I have some before and after pictures that I could show you in consultation demonstrating the natural results that we get in that area. And like I said, it just overall tends to be more economical than doing a bunch of lasers in the area. How long does it last? I was told that lasers are temporary fixes for sunspots. Um, well, I don't think of it as temporary. I think of it more as sunspots tend to come back. So, what we are treating on your skin today is when you come in for the visit is all we're able to treat. So we can't treat the spots that are going to come out in the future. And usually, when you get a sunspot, it's because of sun damage you've had in the past. So, starting when you're a kid, the more sun you had when you're a kid, the more sunspots you're going to get. But they don't pop out when you're a kid, unfortunately, because then we would all, stop getting sun at that age, but they pop out decades later. And so we treat what you have that day, but it's natural to get new ones. And then some of them will come back, especially the genetic ones, because it's kind of programmed in your DNA that you're going to have these genetic spots. And so it's not that the laser's wearing off, it's just that maintenance is required. And so, as I said earlier, I'm a strong proponent of maintenance. And so I recommend doing this treatment once a year. And if you are more prone to sunspots, it depends on environmental and genetic factors. We can talk about doing, for instance, like an IPL 6 months later to kind of maintain your results. Will hyperpigmentation lessen each time Fraxel is done? It does tend to do that. Everyone's different, but in general, yes, it will. Um, Acne scars, how effective is it? I love that question. Thank you. So for acne scars, I recommend 3 to 6 treatments. The more treatments you do, the more effective it is. I've had some patients do 8, 10, or more treatments, and those are my patients who, of course, have the best results. If you do 3 to 6 treatments, we're aiming for a 50% improvement in the depth of your acne scar. So the scar will get more superficial. Um, and it will be less noticeable in certain lights, shadows, etc. And lots of times I will add on to that by doing another treatment as well, like Sculptra, for instance, or injection of fillers. But for patients who prefer not to have injections, I do treat tons of scars, and it is really, really receptive. They are really, really receptive to Fraxel. Again, 50% improvement is always my goal. Sometimes we're able to achieve 75% improvement or more. Will it soften rough patches of AKs? Yes, and it will make them go away, at least a portion of them. Do we use the Resurfix? Yes, we do. We have the Resurfix at our Bell location. The Fraxel is a stronger version of this technology. Do you have before and afters for someone who has sun damage on the arms and legs? Um, I'm sure we do. We just don't have any in this presentation, but I would love for you to come in for a consultation. The cost to add the neck if you are doing the treatment already is $800. If you're prone to bruising, that is not an issue. Okay. Let's see. What procedure can be done for lines around the mouth without using filler? I've had Fraxel and it didn't do much for my mouth wrinkles. Um, if you've had Fraxel and you weren't super impressed, you can do more Fraxel, which is better for your other skin. Or you could go for something more aggressive, like a traditional CO2 ablative laser, which will give you basically it will make the area kind of burned looking for 2, 3 weeks, and then you can have several months of redness after that. But that is probably the best way beyond filler to get improvement around the mouth for those stubborn wrinkles. Oh my gosh. Thank you so much, you guys, for these nice messages. You guys are, Kristen, you just made my day. Thank you. PDT. How do results differ from PDT? Okay, so here is the answer to that question very simply. PDT does not do cosmetic improvement. The results, in my opinion, for the efficacy of PDT versus Fraxel are similar. So same number of AKs removed, PDT versus Fraxel in general. That's my opinion. I don't think there's been a head-to-head study. And thirdly, my opinion is the Fraxel is much, much, much more predictable. And I've had patients who came in who absolutely hated PDT, hated it with a passion. I can't even say it in front of them without them going into PTSD, and they love the Fraxel. What is the cost of the face Fraxel only? So the cost of the face only is $1,550. For this webinar, you get the chest added on at no additional cost. Let's see. What are the risks for Fraxel? Well, for any laser, I put this in all the laser consent forms. The risks are infection, scar, and not getting the results you want. So that goes for any laser. But again, I love the Fraxel because it is so safe. But regardless, say you came in, and usually if someone has a history of cold sores, we ask you if you have a history of cold sores, you say no, and then you break out in cold sores and you don't let us know. And then you have horrible cold sores, and because of the broken skin, can spread. That might be an instance where you get scarring. But we do things like prevent do prevention for cold sores, give you antivirals. We call and check on you 3 and 7 days after treatment. We encourage you to call us with any questions. So we do things like that to try to reduce the risk as much as possible. And that's why we always recommend going to a facility that's supervised with doctors, even if it's not here. There are wonderful places in town you can go and have doctors who are directly involved in your care. So I think we're going to wrap it up. Thank you all so much for attending. Thank you for these really wonderful questions and comments. And thank you for all the wonderful, nice comments too. So please call and take advantage of that. I promise you, you're all candidates for Fraxel. See you.